Hello everyone, welcome to De-Roofing Dentistry. This is Dr. Kushali Arora, and in today's lecture we will discuss Introduction to Complete Denture. Complete denture treatment is one of the most important aspects of prosthodontics because it aims to restore the oral function, aesthetics, speech, and psychological well-being in completely dentureless patients. In this lecture, we will cover definition, functions, components, surfaces, and parts of complete denture. Understanding these basics is essential before learning impression procedure, jaw relation, and denture fabrication. So, without wasting time, let's get started. So, what is a complete denture? A complete denture is defined as the replacement of the natural teeth in the arch and their associated parts by the artificial substitutes. It can be classified as removable complete denture and fixed complete denture. A complete denture can be maxillary complete denture, mandibular complete denture, or complete denture in both arches. Now, the functions of complete denture. So, complete denture have following functions. Aesthetics. The complete denture should restore the lost facial contour, vertical dimension, etc. Artifacts like stains can be incorporated in order to improve the aesthetics. Then, mastication. A complete denture should have proper balanced occlusion in order to enhance the stability of the denture, and a complete denture helps patient chewing food efficiently, although chewing efficiency is less compared to the natural teeth. Then, phonetics, that is the speech. One of the most important function of a denture is to restore the speech of the patient. They help patient pronounce sound correctly, especially labiodental and sibilant sounds. Complete denture also helps patient gain self-confidence by replacement of missing teeth. Now let's see the components of CD. So, complete denture have two components: surfaces and parts. So first, surfaces. Complete denture have three surfaces. The first one is the impression surface. Then we have the polished surface. And the third one is the occlusal surface. The impression surface is that portion of the denture surface which has its contour determined by the impression. So this surface here that you are able to see, which will be towards the mucosa, that is the impression surface. This surface refers to the surface of the denture that will be in contact with the tissue when the denture is seated in the mouth. Then we have the polished surface. So this shiny surface that you are able to see here is the polished surface. That portion of a surface of a denture which extends in an occlusal direction from the border of the denture and includes the palatal surface. It is the part of the denture base which is usually polished, and it includes buccal and lingual surface of the teeth. So, this surface should be well polished and smooth to avoid collection of food debris. Then the third is the occlusal surface. So that portion of the surface of a denture or dentition which makes contact or near contact with the corresponding surface of the opposing denture or the dentition. So the surface of the teeth that are occluding with the opposite arch is the occlusal surface. Okay. Now we can move on to the parts of the complete denture. So the parts of complete denture are as follows. The first is the denture base. Then we have the denture flange. Then we have the border, denture border, and the denture teeth. Okay, so let's get into it one by one. So the first is denture base. A denture base is that part of the denture which rests on the oral mucosa and to which teeth are attached. So, it is usually made of acrylic resin. So, this pink part here that you are able to see is the denture base. Okay, the denture base forms the foundation of the denture and it helps to distribute and transmit all the forces acting on the denture teeth to the basal tissues. Okay, so we have two types of denture base: acrylic denture bases and metal denture bases. Now let's see the acrylic denture bases. So it is the most commonly used denture material. It is easy to fabricate and economical. So this pink structure that you are able to see here is the acrylic denture base. Okay. Now, acrylic denture base has its own advantages and disadvantages. So let's see them one by one. So first, the advantages. The first advantage of the acrylic denture base is that its color is translucent pink, which closely resembles the gingiva, providing good aesthetics. Okay. Then these dentures can be easily rebased and relined. Then the material is quite strong and can withstand normal occlusal forces. Now, the disadvantages. So, it cannot be used in thin sections. And hence it affects the speech of the patient. Also, it does not transmit any heat. Also, it does not transmit heat. So the patient's perception of the temperature of the food is decreased. Now, let's see the metal denture base. So, as you can see here, there is a metal portion in the denture base. So, such dentures are called the metal-based dentures. Okay. Now, metal-based dentures can be fabricated using gold alloys, chromium cobalt, or nickel chromium alloys. Okay. Now, metal denture base has its own advantages and disadvantages, just like the acrylic denture bases. So, metal denture bases are heavier and so aids in retention and stability. Then they have good thermal conductivity. They stay strong in thin section. Now, let's see the disadvantages. So, the metal denture bases are more expensive. Also require more time for fabrication. Then they are difficult to fabricate. Require refractory cast material and cannot be rebased. So these were the advantages and disadvantages of the metal denture base. Now we can move on to the denture flange. So the essentially vertical extension from the body of the denture into the vestibule of the oral cavity. Also in the mandibular denture, the essentially vertical extension Along the lingual side of the alveolo-lingual sulcus is the denture flange. So, as you can see here, this pink portion is the denture flange of the mandibular denture. So, flange that is in the anterior region here is the labial flange. Then, the flange that is buccally is the buccal flange. Then, the flange which is towards the tongue is the lingual flange. Okay, so the flange is divided into three: the labial flange, the buccal flange, and the lingual flange. The portion of the flange that is towards the lip is the labial flange. The portion of the flange that is towards the mucosa of the cheek, that is the buccal flange. And the portion of the flange that is towards the tongue is the lingual flange. Okay. Now we can move on to the denture border. So the margin of the denture base at the junction of the polished surface and the impression surface is the denture border. So this portion that you are able to see here, that is the junction between the polished surface, and from the internal surface there is the impression surface. So the portion of the denture base that is at the junction of the polished surface and the impression surface is the denture border. Okay, so this whole portion here in the maxillary denture and this portion here in the mandibular denture is the denture border. Easy, right? Now the denture teeth. It is the most important part of the complete denture from patient's point of view. The function of denture teeth are aesthetics, mastication, and speech. They are made of acrylic, or porcelain. Okay. Now, there are different types of denture teeth which are classified as follows. So, based on material, we have acrylic teeth, porcelain teeth, then we have the IP and resin teeth, that is the interpenetrating polymer network resin. Okay, the fourth one is gold occlusal, and we have acrylic resin with amalgam spots. Acrylic teeth and porcelain teeth are most commonly used teeth. Okay, now based on the morphology, we have 5 types of teeth. We have anatomic teeth, semi-anatomic teeth, then we have non-anatomic teeth, we have crossbite teeth, and metal insert teeth. For now, anatomic, semi-anatomic, and non-anatomic teeth are important for you. Okay, so they might ask you about the angle of the anatomic teeth, semi-anatomic teeth, and non-anatomic teeth. So, as you can see here, I'm roughly drawing a cusp of a molar. So, in the anatomic teeth, this angle is 33 degrees. In the semi-anatomic teeth, it is 15 degree, and in the non-anatomic teeth, the angle is 0 degree. So the curves are flat. Okay. In the anatomic, the angle is 33. Semi-anatomic 15 degree and non-anatomic 0 degree. So to conclude, complete denture prosthodontics is an important branch of dentistry that restores the oral function and improves the patient's quality of life. A sound understanding of the basics is essential before proceeding to the clinical procedures such as impression making, jaw relation, teeth arrangement, and denture insertion. So, just to summarize today's lecture, a complete denture replaces all the missing teeth and associated structures. They restore mastication, aesthetics, speech, and also provide psychological confidence to the patient. Okay, now the main components of the denture are the surfaces and the parts. So the denture have three surfaces: impression surface, polished surface, and the occlusal surface, and have four parts: the denture base, denture flange, denture border, and the teeth, denture teeth. Okay, so that is all about today's lecture. Thank you for watching the video. If you liked my video, please do share and subscribe the channel. Thank you. Bye bye.